If a patient comes to me in the office and they have complaints, they have backache, they have stiffness, they're in that age that I expect, and in males it tends to be a little bit earlier of a presentation than in females. Once they develop these symptoms, if there's also accompanying complaints like the bowel, having loose stool, difficulty with eyesight, eye pain, the whole constellation might tip me off that they might have ankylosing spondylitis. The diagnosis is made by looking at x-rays, and so when we look at an x-ray of the spine, we could see, if it's a later presentation, ankylosis, which means bridging bone, where there used to be a mobile disc. So the disc becomes calcified on the outer rim, and it leads to a characteristic appearance on an x-ray, which has been called bamboo spine, because these ridges that lift up become calcified, and it looks like one big sweeping sheet of bone that has little undulations, just like a stalk of bamboo. The other place to look is the sacroiliac joints. So an x-ray of the pelvis is part of the diagnostic criteria to look for inflammation of the sacroiliac joints, which is where the spine meets the pelvis. You can also send blood work for inflammatory markers. There are different blood tests that can be done that test inflammation in the system. There's a genetic test, which is called the HLA-B27, and it doesn't mean that you definitely have the diagnosis if you're HLA-B27 positive, but 90% of Caucasians with ankylosing spondylitis have positive HLA-B27. I would say to patients that have been diagnosed with ankylosing spondylitis, it's really important that they maintain a good relationship with their doctor, particularly their rheumatologist. They can serve as a gatekeeper, letting you know when medicines aren't working and when surgery might be necessary, and they can modify the regimen to make sure that your function is optimized and your symptoms are at bay.